one world currency.
The New World Order.
Those are the roots of trouble.
I imagine that right now you're feeling a bit like Alice, tumbling down the rabbit hole. Let me tell you why you're here. You're here because you know something. What you know you can't explain, but you feel it. You felt it your entire life. That there's something wrong with the world. You don't know what it is, but it's there, like a splinter in your mind, driving you mad. It is this feeling that has brought you to me. This is your last chance. After this, there is no turning back. You take the blue pill, the story ends. You wake up in your bed and believe whatever you want to believe. You take the red pill, you stay in Wonderland, and I show you how deep the rabbit hole goes. All I'm offering is the truth, nothing more.
For we are opposed around the world by a monolithic and ruthless conspiracy that relies primarily on covert means for expanding its sphere of influence, on infiltration instead of invasion, on subversion instead of elections, on intimidation instead of free choice, on guerrillas by night instead of armies by day. It is a system which has conscripted vast human and material resources into the building of a tightly knit, highly efficient machine that combines military, diplomatic, intelligence, economic, scientific, and political operations. Its preparations are concealed, not published. Its mistakes are buried, not headlined. Its dissenters are silenced, not praised. No expenditure is questioned, no rumor is printed, no secret is revealed. But I am asking your help in the tremendous task of informing and alerting the American people.
And now, welcome to another episode of Down the Rabbit Hole. Here's your host from federaljack.com. It's Popeye.
Ladies and gentlemen, welcome to tonight's live edition. It is January 18th, 2013. And tonight, I am pleased to bring it to the broadcast for your informational awareness. A dentist with his head screwed on properly. That's right. You're going to hear for 2 hours tonight from a dentist who knows all about the dangers of fluoride and many other things too. And if we have time, we'll expand on some of the other things. But I want to get his take on fluoride, why it's dangerous. And the reason why it's important to have a dentist on is because many people go to their dentist and they say, well, you know, I went to a website and this website said that fluoride's bad for me. And the dentist will say, well, you know, I can go to websites that will tell you that purple unicorns, purple flying unicorns exist, and, you know, come out with some crazy response like that. I've actually had dentists say things like that to me when I've tried to, I won't argue with them, on my radio show. I don't get into that. I just say, look, I've seen a lot of information, blah, 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 and they always try to come up with some excuse why the anti-fluoride crowd is insane. Well, tonight you're actually going to hear from a dentist who thinks differently, and he was telling me off air, and you'll hear him say this, in his own words and out of his own mouth, that there are other dentists out there like him, and many of them may be afraid to come forward. And I hope that his courage and the balls that he has will maybe encourage other people to step up to the plate. So without wasting any more time, I want to bring to the broadcast my guest for this evening. Not only is he a dentist, but he's also a listener. He listens to the broadcast on somewhat of a regular basis. And I've chatted with him off air before. He's a very, very enlightened individual. Let me bring up his bio here that I have for him because I want to make sure everybody understands that he's not some Johnny-come-lately. Okay, he graduated from Tufts University School of Medicine back in 1997, and he's had his own practice since 2000. So he's not some fresh, meathead, know-nothing doctor. He is intelligent, and he's truthfully. This is someone that other dentists perhaps should take a note from, and maybe this is how you should treat your patients. Just saying, guys. I wish I had him closer to me because he'd be my personal dentist. Anyway, without wasting any more time, I want to introduce Dr. Jason Pujo. Jason, are you here?
Hey, Popeye. How you doing tonight?
Man, thank you so much for coming on the broadcast with me tonight. as I said in the opening there, it's important that I think people hear from a dentist themselves the dangers of fluoride, as opposed to just hearing, oh, when people tell you fluoride's bad, they're crazy conspiracy tarts. So I want to give you most of the remainder of the first segment here. Let's start off with what woke you up as a dentist to the dangers of fluoride, because there's so many dentists out there, as you know. You get you guys are fed propaganda, and a lot of them just believe it. So what made you say, well, I need to look outside the box, something's not right here?
Well, I had heard, you hear the stories about how fluoride is bad, or, the tales about how fluoride is bad occasionally from patients coming in or from people that you meet. But of course, your training, your education, you just discount that and say, they don't know what they're talking about. But what woke me up to really investigate this was listening to Russell Blaylock a couple of years ago, about 2.5 years ago. And him talk about fluoride. He was also talking about vaccines and other issues. But when he started in talking about fluoride and what it does to the pineal gland and what it does to the brain and what it does to at the cellular level, I realized, well, if the neurosurgeon doesn't like fluoride and knows that it's bad, then I really need to look into this and investigate it for myself and actually get studies instead of relying on what I was taught in school. And so that began my journey, along with a lot of other things about the same time, to learn the truth about it and not take what I had learned or been taught in school for granted. So, and
okay, so if I was a dentist, right, and I see that you've woken up and you start telling your patients about fluoride and stuff, and I want to perhaps maybe study it more. I'm not saying that maybe I'm one of these skeptical dentists that doesn't believe it, but I would like to look into it more. Where did you start to look? Like, if I was a dentist that wanted to take the same trip that you did, that woke you up to where you are now, how would you introduce another dentist who's brand new to it? What would you say to them to wake up?
Let's see. The first study that I went after was one of the ones that Dr. Blaylock mentioned, which was a study conducted locally by a woman by the name of Phyllis Molyneux. And in her study, she studied fluoride effects on rats and cognitive ability. And what he had said about it was true in the study, that what fluoride does in the doses that are administered in water supplies, it kind of makes people lazy. So that I found that intriguing when he said it. He described it as like a couch potato type syndrome. And so that's what I did. I started off by looking up that study and purchasing it. Now, I went to PubMed. PubMed is the government's clearinghouse for medical studies, and looked it up there. And I don't quite remember if I couldn't find it. I think I couldn't find it there, which I, raised a red flag. So if I can't find it there, just continued on with an internet search and found Science Direct. Science Direct is a clearinghouse of studies. The website is produced by. I always have trouble with the pronunciation, but it's Elsevier, big European company, big European publishing company in medicine. Anyway, I was able to find the study there and purchase it and read it. And so the first study, there it was. Fluoride is a problem. So let's continue on. So go back into Science Direct and just search studies and purchase them. And
that led you down the path where you are now, where now you realize that fluoride is dangerous. So
exactly.
All right. So now you're on this path. You're a dentist. You've realized that something is up. Now you realize that everything you're told is at least about fluoride, and about other things too. But we'll focus on fluoride for a second. We'll say that the things that you're told as a dentist are garbage about fluoride. What do you do? How did you react to that when you realized that you have, like the American Dental Association or whatever they're called, giving you guys information saying, yeah, fluoride's good for teeth. There's no such thing. These conspiracy theorists, whatever, however they put it forward to you guys as a doctor, as a dentist. Once you realized the reality of what was going on, like how did that hit you? Did you have like a I don't know, like I'm trying to think of the term for it. Like, was there suddenly like a rude awakening for you? Like, wow, these people either don't know what they're talking about or they're towing the party line intentionally.
Yeah, I would call it a realization. That's
the word I was looking for.
A realization that somebody's got a bigger agenda here.
Yes, an epiphany. That's the that's where I was going with that. I couldn't come up with the word for some reason. It must be all the fluoride that I ingested when I was a child. Although,
hey, I was right there with you. I grew up in a fluoridated town, and that's one of the reasons why a lot of us discount it, is because of our own personal experiences. And up where I am in Massachusetts, I think the vast majority of towns are fluoridated. So, and most of the people that I went to dental school with, well, we were all true believers in fluoride, so to speak, and So whenever we'd encounter somebody with the opposing argument, we would just discount it instead of being scientists and actually saying, okay, well, let me take this data and let me check it on board and look at it and analyze it and see what it says, And
as soon as you actually did do the research as a scientist, like you're supposed to, you realize, all is not that it's being said it is. Something is rotten in the town of Denmark.
Exactly.
And then you just went from there. So, all right. So then as a practicing dentist, what did you do when you had this sudden epiphany that fluoride was no good and that you started reading these studies and you realized all the damage it causes to teeth and everything else? How did you start telling your patients about it? I mean, obviously, I know I call it truth or diarrhea of the mouth, where you learn something and all of a sudden you're like, oh my God, 9/11 was an inside job, this, that, the other thing, New World Order, blah, 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 fluoride, AIDS, whatever, you know what I mean? And you just start rattling things off. How did you control yourself and say to it, like, how did you, obviously you must have sat down for a while and thought about how you were going to introduce this information to your clients, correct?
Yes, and we're still slowly introducing it. We haven't come out and just hit everybody with this yet. I wait for it to come up in conversation. But on my end of things, we've removed the fluoride from the office and the products that we use. And we even stopped giving the fluoride treatments to the kids. And nobody, if they haven't noticed, nobody said, why did you give them the fluoride treatment? There have been a few people that, of course, they're with their kids and asking about the fluoride treatment. Oh, you're not going to do that? And I just explained to them, yeah, I've done a lot of research on fluoride, and you know what? It really isn't all it's cracked up to be. And it does have a lot of medical side effects, which are very subtle, but are there. And, ultimately, if the patient wants me to do it, I will do it because, again, I don't want to make that decision for the patient. I want them to make that informed choice, but when somebody is given all the information, they're not going to make a wrong choice either. So,
do they usually say to you, like, "Thank you for telling us about this"?
Oh yeah, I've had that. Yep. So, and I've had a few people. I've had a few people that, of course, were were against fluoride to begin with, and then once they've thanked me for investigating it and looking into it and doing my job as a dentist. So,
Well, I mean, it's your job.
Exactly.
You're a doctor. You're supposed to be concerned about dental health and overall body health,
Mm-hmm.
And to me, if I was a doctor and I found out that I was doing that I had been duped like that, I'd be pissed off. I'd be angry that I'd been lied to. And I'm pretty sure that you probably had that same feeling, correct? That you were, I'm sure you were probably a little irritated that you had been lied to about this and that you had possibly poisoned people for a short, a brief period of time,
right.
However long you've been using them. And I say brief because there are dentists that have been using fluoride for like 40 or 50 years. Obviously, you haven't been using it for that long. So,
right.
But I did it piss you off when you found this out?
No, I think it just, I think at this point it's par for the course. I'm so used to things not being exactly the way they're supposed to be or what they seem to be on the surface. So it's just going along with what so many people at least listening to this broadcast already know, that life isn't what we've been told it is. So again, I think at that point it was just par for the course. Like, okay, here we go. Here's another thing that, is not what the bill of goods that we've been sold. So
it's impressive to hear a dentist say, well, and I should say a dentist, a doctor say that hey, everything is not as you would think, and perhaps you should look outside the box. It's refreshing to hear somebody in a professional position, I guess you could say, or whatever you want to call it, have the courage to stand up and say that. Because, it's getting on our end of it. I've got 3 children, and it's frustrating on our end of it, bringing them to the physician. We have found a physician who is a no-vax physician, but in learning all about fluoride, we're also learning about we learned about vaccines, this, that, and the other thing at the same time, and coming to these understandings. And it's very frustrating to go to the physician's office and they have that attitude, like, oh no, there's nothing wrong with them, they're fine, there's just a little bit of preservative, and they don't even know what they're talking about. And have you ever butted heads with a doctor at all before? Because you're a doctor yourself, and now that you've researched vaccines and fluoride and all this, have you ever butted heads with a doctor and said, no, you're wrong?
No, I'm usually not the one that took the kids to the physician's office. So, so I was.
Perhaps it was better for the doctor that you didn't take them to the physician's office. It was better.
It was a better situation. Perhaps. I did kind of butt heads. I did butt heads a little bit with my former nurse practitioner at my physician's office when he wanted to give me a booster for hepatitis B. Like, what do you need a hepatitis B booster for? Now, I had my round of hepatitis B vaccinations when I started dental school back in '93. And so 2 in '93 and 1 in '94. And, what do you need that for? He's like, well, we're doing these every 5 years now. 5 years for hepatitis B booster? Why? He's like, well, we can test your immunity if you want. So we did a blood titer, and I'm still immune to hepatitis B at this point. So what are they doing that every 5 years for? I don't want to derail off the fluoride, but
no, but that's a good question, and see that again. There you go. It takes courage to be a doctor, any sort of doctor whatsoever, and just bring up the question that you just brought up about vaccines.
It just amazes me how many people in the field are going along with what they're being told from the higher authority, and they're not looking into it for themselves. It's, I know that there's.
Well, isn't that one of the biggest problems in this whole thing?
Yeah, exactly. I know that they're very busy during the day, and there's not a lot of time to sit during the day and look at things. But do your job as a physician.
I agree. I mean, look, if I was a doctor, I would want to know if I was prescribing something that was horrible. I mean, I tell everybody, look, when I first started investigating 9/11 truth, and I've never trusted the government ever, and I'm sure you've heard me say this on air before, I started investigating it because even to a certain extent, when someone told me, 9/11 was done by the government, I was like, well, maybe they lied about how things went down, but come on, that's pushing the envelope, and I got uppity about it. I was a firefighter, I got pissed. So once I investigated things, dude, you know what I realized? I realized that I was the one that was wrong, and that I had to get over myself and my preconceived notions about things and be willing to accept evidence, whether or not I liked it. I had to get rid of the emotional attachment to it. And honestly, I don't even think it's emotional attachment, though, when it comes to a lot of these dentists. You hit the nail on the head when we were chatting off air before we came on air tonight. A lot of it is, I think some of them are afraid. Not even some. I think a lot of them are afraid for their careers because it's still, I guess, at least because of the mainstream media, right, and because of pop culture and stuff, it's still kooky to say that fluoride is bad. Although anybody that's educated knows that that's not the case, but it's still put out there that idea that if you question it, it's kooky. So how many dentists just go along to get along? You know what I mean?
I have no idea. I know, like I said off air, I know of one other guy in my immediate area who understands that fluoride is a toxin. He doesn't promote the use of it, but it's very quiet. And I'm not going to out him on the radio show now either. But I respect his decision. But I really don't see. Other than, your buddies might not call you for a round of golf. I don't know. I'm having a hard time with what the issue would be to say, okay, hey, we've learned some new data. We've seen some new science. We understand now that even some of the original studies were doctored. They weren't honestly put together to promote it in the beginning.
Well, imagine that.
Yeah. So, if you come to your patients with that, I think your patients are going to be very understanding and appreciative of your quest to give them the right information for their own health.
I agree. I think a lot of it's how you present it to your patients. I think if one day you were, dentist A, and then the next day your patients come in and all of a sudden you're, oh my God, whoa, that's not going to help the situation. I think, slowly introducing them to some of these ideas is the way to go, because how much, just as much propaganda that you've been fed, think about how much propaganda they've been fed about, oh, you need fluoride, right? How many parents come in requesting fluoride? A lot.
I don't know. I don't know. Nobody's ever come in to request it. It's just more accepted as standard procedure in a dental office. So
really,
but like I said, I haven't had anybody fight me on it either. So
so you haven't had anybody, like, since you've cut it out and you started warning people about it, you haven't had anybody put up any sort of, oh, doc, you're not one of those conspiracy theorists. Nobody said that to you?
Not at all. Not at all. So look,
So would you say
you present it the right way? It's not going to get a lot of flack, at least with this issue.
So then, would you say, like, as a dentist to another dentist out there that might know about this but might be afraid to alienate whoever, would you say that there really isn't? That's more of an invalid fear, and it's more just fear controlling you than anything else. Yeah,
it's more just assumptions on our part. It's I'm the meme that goes through dentistry is, those people, they think it's a commie plot, and ironically, most dentists would probably align themselves with the conservative side of the political spectrum. You're a self-starter, you go to dental school, you own your own business. I'm not saying that everybody is, but most of the people that I've met through my career, kind of lean towards the right side of the political spectrum. So you'd think that, say, if the meme of it's a commie plot that actually investigated and say, well, maybe it was a commie plot, but no, they just laugh at that and then move on and say, no, it's perfectly safe.
Which is rather sad, because it's sad because a lot, these guys are very well educated, and at the same time you see them buying into just propaganda garbage. Jason, I'm going to cut us off because we got a break sneaking up on us. Ladies and gentlemen, don't go anywhere. When we get back, we're going to get more into fluoride. Ladies and gentlemen, we are back. Don't forget, tonight we are joined by my special guest, Jason Pujo. He's a dentist who has the courage, the balls of steel, I would say, to say, you know what? This fluoride thing's a little crazy. I need to look into this. This mercury filling thing, this doesn't look right. I need to look into this. As a doctor, I need to make sure that my patients aren't being harmed by the things that I do. I took an oath to not do that, to do just the opposite. So you guys that are out there that are dentists, other doctors, whatever, maybe you should take a note tonight from my guest as to how to behave yourselves as a doctor. And I'm being serious when I say that. In fact, Jason, do me a favor. I want you to plug your practice right now on air. Phone numbers, address, everything, so that if anybody is in the area, they can come see you as their dentist, and maybe somebody will move to the area just so that you can be their dentist. But go ahead and plug it.
Sure. It's my name, Jason Pujo D.M.D., and we are located in Dracut, Massachusetts, which is a small town sandwiched between the New Hampshire border and Lowell, Massachusetts. And phone number is area code 978-957-1898. And the website is pujodentistry.com. And the last name is spelled P as in Peter, U-J-O, Pujo. So it's an Albanian last name.
Awesome. Okay. So now, if I was going to come to you, right, and say, Jason, or say I didn't know you, right? Say I was going to come to you as one of your patients, and I say, Dr. Pujo, I've read some of this information online about fluoride, and we can get into the mercury fillings thing in a little while, but say they just come to you about the fluoride thing first, and they say, look, I'm on the fence. I've read some stuff on fluoride, And some of my other dentists in the past have said there's nothing wrong with fluoride. It's good. It's fine. Whatever. You know, what's your take? Talking to you will be the thing that, you know, makes it or breaks it. What would you say if you were in that situation, or if you could speak to somebody who is in that situation? They're on the fence. They're not sure. As a dentist, as a medical professional, what would you say to them to introduce them to the dangers of fluoride?
Well, the thing I think that might tip it over for them would be the fact that it doesn't work in water fluoridation settings, and it is unnecessary for your average person to use. So why put something that is a toxin into your mouth and into your body and it doesn't get the results that you've been promised? Well said.
That's very, very small, to the point, and in a nutshell, which is, I think, the way it needs to be, not too long and drawn out. What would you say if I said to you, okay, I don't believe what you're saying. I respect your opinion, but I don't believe that fluoride is bad for me, and they just want to put up, they want to have the contrary stance. They don't want to, because I'm surprised actually that most people are very like, oh, okay, or not even paying attention, which that's a separate issue. You and I were talking about how parents aren't even paying attention to the fact of what their kids are getting done to them, so they don't even realize that you're either A, giving them fluoride or not giving them fluoride. They kind of just take advantage of the fact that you're a dentist and you're supposed to be the professional and you know what's best, which that's how all of this has happened to begin with, right? Because now the parents aren't questioning things, and they're relying on the dentist, and then the dentists get told by the dental association what they're what's good and what's bad, and they kind of eat that up unquestioningly, which is wrong too. Wouldn't you say that it's, I know I kind of sidetracked this for a second, but wouldn't you say it's wrong for these doctors to not look into this, especially if someone like a parent, a concerned parent, brings it to their attention? Me personally, from an outsider's point of view, I think it's negligent on their behalf if a parent says, look, here's some real information, here's reports from the government, whatever, here's studies that prove it's no good, blah, 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 from colleges, wherever, universities, and for the doctor to blow that person off and laugh about it or not take their concerns seriously. To me, I consider that negligent. What say you as a dentist?
Oh, yeah, it's definitely negligent. It's going to come back to bite them in the butt someday. But, it's also ego-driven. I'm the doctor, they're the patient. And, that's what's rolling around in their heads. And, to not listen to your patient's concerns, it's a violation of rule number 1. You're supposed to be there to treat the patient, but you can't treat the patient without collecting all the data that you need in order to find out what's wrong with them. So if you're, not listening, you're gonna screw up somewhere.
That's amazing that you actually listen to your patients. And I know that sounds odd that I say it's amazing, but trust me, nowadays most doctors don't listen to the patients. Well, you just said most doctors have that attitude of, I'm the doctor, you're the patient. Sit down, shut up. I know it's right. I'm the one that went to college. You didn't.
Yeah, it's pretty widespread, and it's part of the whole it's part of the whole professional school mindset. You made it this far in school. You're going for the advanced degree, and it definitely. I don't want to throw everybody under the bus. There's plenty of us out there that don't think like that, and there's plenty of physicians that don't think like that. Although I think you're going to have a harder time finding them these days.
Yeah, I would agree. You're going to have the older school people. Are more open-minded about things, I find. I mean, there are. You can't say on an umbrella statement all. Like you said, all of them are bad, because there are good ones. That would be incorrect for me to push that idea. But like you said, it's just like with good cops versus bad cops now. Unfortunately, there's more bad cops than there is good cops. Same thing with doctors. There's more. I don't want to say brainwashed, but maybe that's the proper term to use, brainwashed doctors than there are doctors like you who say, wait. I took an oath to not hurt people. If this crap is a toxin and we're putting it in their mouths or in the water supply, hello? Doesn't take a rocket scientist to figure out that we're causing harm to the very people that we took an oath not to cause harm to. And they're not even taking the Hippocratic Oath anymore, right? Someone told me that doctors aren't taking the Hippocratic Oath anymore.
I don't know. I can't speak to that. I
have to research that more in depth, but someone was telling me that they're not taking and I've heard it from multiple different sources actually, but I have to, if anybody out there, any of the listeners, has any information on that, feel free, email me, contact@DTRH@yahoo.com, contact@DTRH@yahoo.com, and email me and let me know, because I've heard from multiple sources that doctors aren't taking the Hippocratic Oath, and if that's the case, that's even scarier, because they're supposed to do no harm, which, again, by you paying attention to the fluoride, and you and I were talking about vaccines and other things off air, you're supposed to pay attention to that. You took an oath to, hey, I won't do any harm, and if I find out that, and under that oath, falls the subtext of, if you find out that you are doing harm, you should stop doing it. Not go, oh my God, I've been doing this for 20 years. I don't want to get sued, so I'll just keep doing it. Well, yeah, that makes a lot of sense, because just prolonging doing it to people is much better than stopping and saying, hey, look, you could always put it across like, look, recent studies have shown that this stuff maybe isn't as good as they thought it was, so we're going to try to back off using it because it's better for your health. I think if you approached it from that gentle direction alone, people would probably be like, oh, really? New studies? Thank you, doctor. You know what I mean? Because most people aren't going to question that. I think if you were a doctor and you came up, what do you say? You're a doctor. If you presented it that way to a patient, do you think they'd be more understanding of it and less likely to flip out?
Exactly. They'd be very thankful that you're actually paying attention to the latest research. That's what they want you to do. When I bought my practice, that was one of the things that, just like two schools of thought running through a patient's head. One of them is like, the older dentist, well, he's experienced, he's seasoned, he's been around the block a few times. But then the new guy out of school also has all the latest information and, the latest techniques. So there's two schools of thought running at the same time in most patients' head. They want that blend of both of those. And, so to present it like that, new studies and blah, 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 that's exactly what they want for you to do as their dentist and as their physician. That's what they are expecting you to do, is be up on the latest information. So, of course, it's very comforting for people to know that you're doing your job.
Well, there you go, guys. If anyone's out there that's a dentist that hears this later on, or you're a doctor or whatever, and I know I have doctors and dentists and lawyers and police officers and other professionals that listen to the broadcast. I know they do. I get emails from you all, and you guys message me on Facebook. I want to say hi to all of you. You all know who you are. Thank you for tuning in. But if you're a doctor and you hear this broadcast later on, take this advice. Jason's a doctor. He's telling you. This isn't just some radio show host. This is why I brought him on. This isn't some radio show host named Popeye that does a show called Down the Rabbit Hole telling you that you should look into the dangers of fluoride. This crazy a-hole. Who is this guy to be telling me? I'm a doctor after all. Well, I did one better. I brought a doctor on who's telling you that you should look into this. One of your peers is telling you that this is dangerous and that you need to be paying attention. So it's not me. And like you said, Jason, there's way more doctors that are out there that are awake to this than I think people as a whole, like patients, realize, and that they themselves realize. Like it's just like being awake to what's going on with this agenda and everything that's really going on. People think that everybody around them is brainwashed and that they're the only one in their area that understands what's going on or is awake. And it's funny when you actually start to talk to people and you realize that there are actually more people out there that are awake and tuned into what's going on than you thought. Mm-hmm. I think a lot of that is part of the distraction, you know what I mean? And part of the way they keep us, the powers that shouldn't be, keep us separated and in control. They have us thinking and believing that there are less of us out there, when in reality there are more of us. What say you as a doctor? You were telling me that there are more dentists and doctors out there that are awake than people realize, right?
Yeah. Oh, yeah. They're out there. I mean, again, I don't know why they're afraid, but for whatever reason, they don't want to make it a public issue. But it's not that bad. It's like I said, people appreciate you doing your job. So.
Yeah, I agree. People do appreciate when you do your job, and like you verified, if you came across in a very comforting manner, like, hey, new studies, blah, 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 people would probably be more apt to accept the information, no matter how astounding it may seem. I mean, look at the crap that they buy from the mainstream media on a daily basis. What do you think about mercury fillings? Everybody says they off-gas, they're horrible, they cause health problems, everything else. What do you think about mercury fillings first, and then we can get into the amalgam as like a, when they put, they have to drill a tooth out and put a cap on it or whatever. A lot of times they use the, for the structure or whatever they call it on the inside. I've old school dentists anyway, a lot of them like to use amalgam, and they'll say, oh, I talked with you about this one time off air a while ago, and I told you how I've heard old school dentists say, oh, it's stronger, better, whatever. So we can get into that. But first, what are your general thoughts on mercury fillings? As a dentist, do you use them? Would you use them on a patient?
We stopped using them back in 2004. So I've been away from mercury fillings, silver fillings, longer than I've been away from the fluoride. Although the primary reason why I stopped using it wasn't the mercury issue. I was still working under the assumption, the knowledge that I was given that it was a safe level. So the primary reason why I stopped using it is because the silver fillings are what crack teeth. Anybody that that's broken a tooth, well, it probably wasn't them breaking a tooth. It was the silver filling setting the crack up in the tooth over a long period of time, and then the crack finally gives way and a chunk of tooth breaks off. So the white fillings got to the point where they were as reliable as the silver filling, but they also reinforced the tooth. They're just better overall. So back in 2004, I stopped using it for them. But then, as time went along, yes, I did look into the mercury thing too. And, there really is no safe level of mercury. So, especially elemental mercury, that's the bigger problem with the silver filling. Now, as far as effects, you definitely have your patients that are more susceptible to symptoms and susceptible to an effect from the mercury than others. I think that's probably why it's been able to be used for so long, and wasn't outright banned soon after it was adopted.
Because not everybody had a universal reaction to it.
Yeah, exactly.
So that the effects were more masked than they would be if everybody had a universal crappy reaction to it, is what you're saying. Yeah,
exactly. If you had somebody that had, severe pain, like a fibromyalgia type pain, or, became lethargic, those kind of symptoms, that would have obviously alerted people to that there's a problem with this and it shouldn't be used. But the people that do have symptoms like that or develop some other type of symptom are so few and far between that, the assumption was, it's perfectly safe, so let's use it. And no, again, it's subtle background effects that it's going to cause problems. It does damage cells. It does damage nerve cells, even in the smallest amounts. Mercury is a very, very toxic material, and it really shouldn't be used anymore. And a lot of countries have banned its use. So, where are we? Why aren't we on this?
A lot of countries have also banned the use of fluoride.
Mm-hmm. Exactly.
That's why I have to laugh when people think that when they make the statement to me, "Oh, we're so advanced in this country. What are you talking about, Popeye?" And I just look at them and I'm like, "You have no clue."
No. Hey, let me tell you something about that. There's dental equipment. I had somebody telling me this. It was a course I was taking and whatnot. There's dental equipment manufactured by the different companies that isn't even sold in the United States because we as a profession here, most of us can't afford the type of equipment that these people manufacture. They can sell it in countries like India because even though there's a lot of poverty in India, there's also 300 million wealthy people in India. And those dentists that cater to that group can afford dental equipment that we can't in this country.
That's nice.
Isn't that wild?
That's nice. But yet we'll make fun of people here and be like, ha ha, those crazy people in India, they poop outside. Sometimes they don't even have toilets in their house, and they poop outside in gutters and stuff. Ha ha, it's almost like a third world nation over there. Oh, those people, we're so advanced over them. Really?
Yeah.
Ladies and gentlemen, really?
Yeah, they have the same number of wealthy people that our entire population is in this country.
Yeah, there you go. Enough said.
Yeah. So...
Enough said right there. 300 million wealthy people. Yeah, 300 million wealthy people versus 300 million people in total.
Yeah.
Hello? Anybody see the difference there? That's very telling. That really is very telling. In a country where there are people that are still pooping out in the in the street and out in gutters and stuff, and storm drains or whatever the frig it is, the little runoffs on the sides of the streets there, they're out in the middle, or fields, crapping in the middle of a field. They have better dental technology than we do here in, quote-unquote, the bastion of everything, the United States of America, because we're so far advanced. And I'm not USA bashing, ladies and gentlemen.
No.
I'm trying to bash that mindset that I'm trying to break people into the reality of seeing, look, we are not where we should be. It would be nice if that's where we were, but we're not there. And we're very rapidly, I may add, heading towards, beyond what I would say third world nation status is. People have no idea what's coming with Obamacare. Just wait until you go to the doctor, because now that people are going to be able to have health care, right? Mm-hmm. And that they're going to see fit that if they can't afford health care, they're going to make sure people have health care no matter what. Well, there are people that are out there, and I've seen this, and all you got to do is go back, listen to the article I read from that old lady from Austria about a week and a half ago, where I titled it "A Warning from History," and she wrote about what happened when Hitler came in, and she said when everybody got universal health care, what happened was now that everybody could go to the doctor for any little thing, if their ass hurt, they went to the doctor. So if somebody had gas pains, they weren't like, well, maybe I just have gas, I'll ride it out. As soon as they had a stomach cramp, it was, oh, my God, I have to go to the doctor. So now that's what you're going to see. That's what the future of the medical industry in this country and medical care is going to be in this country. And then she also said that research and development, well, all that money went by the wayside because it had to be funneled into providing health care for every individual. I'm not saying that people don't deserve to be healthy and live good lives and stuff. There is a way to handle that. One of the ways to fund it would be to stop wasting money on bombs and bullets and rockets and blowing shit up in every other country, and instead of taking care of things at home. A quarter of the money we spend on war would take care of things here at home with the healthcare industry. But I don't want to digress too much. The point is that the healthcare industry is already effed up, and it's not like you think it is. And if you think it's bad now, it's only going to get worse with this insurance / Obamacare, whatever, New World Order care, whatever the frig you want to call it. As a dentist, as a doctor, what do you think about that?
Well, luckily, dentistry isn't affected by any of this really yet. And I have a colleague who I haven't seen in a long time, but he was my dentist when I was a teenager. He took over the practice that I was going to. He and his family came over from Israel. They went to dental school in the United States, and he stayed. And at any rate, he was telling me years ago the reason why he became a dentist is because you probably will never see socialized dentistry. I know they have it in England, but you can still do optional dentistry if you want to pay for it. I used to know a guy over there, and they get presented, well, you can have the one that's covered by National Health Service, or we can do a really nice one. And, depending on where you were as, financially, you had that option of going for the one that was covered or the one that wasn't covered, whatever the treatment would be. But that's what he told me years ago was, you'll never see truly socialized dentistry. And now, I don't know, with Obamacare, hey, it went from 4,000 pages to 40,000 pages. So you never know what's coming down with this. But as it stands right now, we're not going to be as affected as the physicians. But, when you talk to physicians and especially the older guys, we all have heard, this has been in the news for a couple of years, they don't know what they're going to do, and they don't know how much longer they're going to practice.
I've heard them say that they're just going to bail. and that they're going to retire because they just don't want to deal with the garbage. And that's sad because now you're losing a lot of well-experienced, well-intentioned doctors that may not be brainwashed like the younger generations that are being taught to be doctors. So it's a bigger problem. It creates a bigger problem that doesn't really solve anything. Ladies and gentlemen, we got the top of the hour break sneaking up on us. Don't go anywhere. Hour number 2 coming up. Ladies and gentlemen, we are back with hour number 2 here on tonight's live edition of Down the Rabbit Hole. I am your host, Popeye from FederalJack.com. Tonight is January 18th, 2013, and tonight I am joined by my guest, dentist, ladies and gentlemen, a doctor, so take what he has to say seriously, Dr. Jason Pujo. Jason, welcome back for hour number 2, my friend.
Thank you.
I wanted to get into the health effects of fluoride and stuff, but before we did, I wanted to throw something out there really quick about toothpaste. Now, some people like Tom's of Maine. I actually just saw it mentioned in the chat, so I wanted to mention this. Now, I don't remember off the top of my head right now, and this is horrible, the brand I use. It's not Tom's of Maine. It's some other natural brand that I use. The reason I don't use Tom's is this. I used to. But there's something else that a lot of toothpaste companies put in their toothpaste that's just as bad as fluoride that they don't tell you about, and that's sodium lauryl sulfate. It is horrible. I don't have time. I don't want to get sidetracked going into too much. Just go Google what it does. Look on it at your tube of toothpaste. I guarantee you it's in there. It's in Tom's. I found this out myself because I used to use Tom's. This stuff is really bad. It's a carcinogen. It's got other negative effects to it. Anyway, there are toothpastes out there that are free of that, free of glycerin, free of a lot of stuff. That some of them are just made with basic like baking soda and a few other things. You can even make your own. There's recipes out there. I know Chris Steiner, I think in the chat room, had dropped one in there, or he was at least sharing one that he knows. So if you want to go to the chat room over on FederalJack.com, you can go look in the chat room and it's there. Or just look them up, whatever. There are natural toothpastes that you can make too. But I just wanted to let everybody know. I know some people like to use Tom's, and I used to use it myself, but it's got sodium lauryl sulfate in it, and that stuff is no good. So if you're using your toothpaste, there's more than just fluoride in there that's no good. What you ought to do is you ought to write down everything that's in your toothpaste and go Google it and look at what it is. And when you realize what you're ingesting and putting in your mouth, once you have an understanding of what it actually is, you're like, oh, I wouldn't put that in my mouth. Half of the stuff you wouldn't put in your mouth by itself, let alone mixed in with all the other garbage. So I just wanted to throw that out there because I saw somebody in the chat, Bob actually in the chat, had mentioned that about Tom's of Maine or something, and I don't remember why he had mentioned, but he had said Tom's of Maine toothpaste, and I just wanted to let people know that no, I wouldn't recommend using that. I used to, but I wouldn't recommend it because I found out they use sodium lauryl sulfate. But there are toothpastes out there, as I said, that don't use it, that are natural, that you can use. And you can always make your own toothpaste too. I've seen different recipes like honey and baking soda and like one or two other things mixed together, and it makes a toothpaste or whatever. And look, there's numerous recipes out there. You can go find them, but there's other options other than that stuff. And the reason I will never ever say, what was it, Crest Pro Health I used that night to do the headlights? I think it was Crest Pro. Yeah, Crest Pro Health. I'll never recommend any of the regular toothpaste, ladies and gentlemen, because the reason what I was just talking about Jason about was he was on. We were all on a group chat, and Jason and I were chatting. And there was a few other hosts that were on with us, and this was off air. We were just having an off air conversation one night, and I went outside to try something. My headlights were fogged out, and they were all yellowed out. So I took a little travel toothpaste bottle of Crest Pro Health, which it was funny because when I was using it, that's when I think you said you would never give that crap to your patients. It's horrible for their teeth with all the garbage that's in there. It's really damaging to the teeth or whatever. So I was like, well, let's see if it works on my headlights, because I had seen that people had homemade thing to polish your headlights up, take that dim away, So I tried it on the headlights with you on the phone with me, right? I had my hands-free device on, and I was like, hold on, Jason, I'll let you know. And I went and I polished up the headlights, and what happened, dude? My headlight, I told you, wow, the shine came back to my headlights like brand new. So if toothpaste is powerful enough to eat the crap off your headlights and bring them to a nice, bright shine again, what is that doing to your teeth? And then what are you ingesting? Because that's going into your bloodstream through your gums, right? Right.
So, a basic baking soda toothpaste recipe would be plenty. I mean, what you're looking for in toothpaste is really just a mechanical action, getting rid of the plaque on the teeth. So a lot of these, but it's like $1 billion industry to come up with different kinds of toothpaste and different flavors, and advertise them, promote them, get people to buy them. It's a big money making industry to get for toothpaste. So, but all you need to do is get rid of the food, get rid of the plaque, get rid of the bacteria. That's all you need to do. So.
And what do you say about like saltwater rinses? I mean, I know saltwater is good for your mouth. It's like a body piercer. I have personal experience where a lot of piercers used to tell people, well, rinse with this, rinse with that. And I used to tell people, look, you could use this, but part of my spiel was use saltwater rinses a couple times a day. Trust me, That's the best thing out of anything you can do for your mouth. And whenever anybody listened to the advice I gave them about how to clean their piercings, whether it was an oral piercing or elsewhere, if they listened to it, it always involved saline solution, which is saltwater, right? So that's how I told them to clean it, take care of it, everything. Everybody was like, oh, I can put Bactine or I can do that. No. Just use saline saltwater. And if they listened to me, it never, ever, ever, ever had an issue. Only time they had an issue is if they didn't listen, they put something on it or they screwed with it that they shouldn't have. So I know from my personal experience that saltwater works both outside the body and in the mouth. But as a dentist, would you recommend saltwater rinses like once, twice a day?
Oh, yeah, definitely. And, we recommend them if somebody's get some kind of sore lesion, somebody had an extraction, and once that initial healing period is over with, to help with healing. Yeah, salt water is one of the best things that you can use to heal your body. I mean, you are mostly salt water, so it just has a great cleansing effect, and it's the right pH for your body to be able to do what it needs to do.
And it's never too late to start, right? Like somebody that maybe has not the best or dental health or whatever, or they have let's say their teeth are I don't want to say decayed, but they're damaged somewhat, maybe from the toothpaste they've used, or they haven't had the greatest dental care, because let's be honest, I mean, is it really affordable for the general public to get really awesome dental care? And I'm not saying you are overcharged or anything like that, but as like a whole, most people can't afford to go to the dentist because it's kind of expensive for dental work. So a lot of people say, well, do I want to pay the electric bill, or can I deal with this toothache? Which that in itself, how bad is that people have to make that decision? Let me ask you this, and I know this is getting sidetracked and we can get back onto the issue and where we were going, but I got to ask you this. As a dentist, don't you think there's a way that we could make this type of medical need, this type of medical care, affordable to everybody? Like, it's not a lot, because I hear a lot of people say, oh, there's no way, dentistry is too expensive, the techniques, all the stuff you need, that's why it's so expensive, blah, blah, blah. As a dentist, honestly, do you think there's a way that we could bring the cost of this down? Like, even if we had to go deal with the companies that make the dental equipment, or whatever wherever the main cost, whatever problem is, do you think as a dentist that there's a way that we could bring it down so that most people, if not all people, could afford dental care without having some sort of socialist utopia, Obamacare, Nazi care, whatever you want to call it? Be honest. You don't have to lie. If it's expensive, it's expensive.
It's hard to say. It's expensive to be a dentist. It's expensive to I don't want to. I'm not whining. Okay, I'm not whining.
No, I'm asking you. That's
I'm saying that to the audience. I am not whining about it, but it is expensive. I mean, the materials are all expensive. The equipment is very expensive. Your overhead is high. Yeah, I mean, your biggest costs are your employees, of course, and that's with any business.
Aside from your employees, if I was going to come to you and say, let's try to solve this as a problem, like a solution,
there's got to be something that can be done.
Do you aside from the employee thing, though, what do you think would be like the number one thing? Or what is maybe one of the biggest? We don't have to say number one, but what's like one of the biggest costs for dentists aside from the employees? Would you say it's like the secondary would be like the technology that you guys need to be able to do your job and your profession properly and efficiently?
Some of it, but probably our biggest cost right now is paying for our office, and
real estate.
Other than what's his face? Other than staff. So, paying the loans on the office, and so that comes back to the banks. Why do they need to? Why do I need to pay for 3 dental offices in order to have 1 dental office?
Oh, very true.
So
when the banks make it, I gotcha. Okay.
Yeah,
that's fair enough. I mean, that's a fair enough answer. That's why, and part of that is the reason I ask is out of ignorance. I don't know if there's a huge markup on it or not. Like I know some doctors charge exorbitant amount of fees for things, and I'm not going to label any professional field, of being a doctor, any particular field, I should say, out, as a target. But I do know that some doctors kind of overcharge. So I just wanted your honest opinion. I've never asked a dentist that question. So I guess maybe if we talk to, listen to me, like 3 people going up and talking to somebody that runs one of these medical companies, we'll listen to you, sure. Mm-hmm. But I guess if the technology wasn't so expensive, it would probably be between that and then, like you said, the rent. But then again, that goes to who controls the banks and the interest rates and everything else. So. Mm-hmm. It brings us right back to the same problem that we have facing everything else. Who controls the money?
Yeah.
So
ultimately, that's where it goes to. Yeah. When you follow it, that's what happens. It's who controls the money.
And that's there you go, ladies and gentlemen, right from a dentist's mouth. So it's not the dentist's. And I would have, again, like out of ignorance, I would have thought. That's why I asked you. I would have thought that. Oh, come on, they're overcharging or whatever. But I know it's expensive. But so, like, if they charge for an implant $2,000 or whatever it is, for like, what do you charge to do an implant?
I don't put in implants myself, but that's about the going rate.
Okay, if you were going to do an implant, like let's say $2,000 or $2,500, is that about accurate for the cost and everything and all the? I mean, knowing what's involved with it, is that an actual accurate cost? There's not actually that much markup on that, then.
If you look at the implant itself, if you think if you're looking at it as just paying for the implant and then paying the retail on the implant, you would look at it and go, "There's a huge amount of markup there." But you got to take the courses to be able to put the implant in, and that's not something that you get in dental school. So, there's the trade-off in what it costs to take the courses to be able to put the implant in the first place. I think the best way to, I know it's been said before, but the best way to look at it is you're paying for the expertise to be able to do the work that we're doing. You're paying for the training and the commitment of the 4 years or more to be able to do the job. Ultimately, I think that's what you're paying for, not your raw materials. Yes, the equipment's expensive. Yes, the facilities are expensive. But ultimately, you're paying for the training. So.
And that's a fair answer, because I can understand that and respect that as someone who's gone to trade school himself for certain specific things. And
well, it's like when you go to the mechanic to get the work done on your car. I mean, the parts you see that in itemized, the parts aren't really all that expensive usually.
No, it's usually the labor that's the most expensive. Yeah, no, that's a fair answer, because like I'm a trained HVAC technician, and I had to go to school for an extra. I'm a diesel mechanic, a certified diesel mechanic by training, but I also took refrigeration and stuff, so I had to stay in for a few extra months to get that special certification. And I didn't, no one, when I got out, nobody was like, oh, here's the money for that course that you had to stay all the extra time for. And, you had to, deal with for your life and, alter things or whatever. No one threw money at you. So I know how it is. When I got out, when I did services, if I had to go out and I did stuff as like a contract worker instead of working for like Thermo King or something, if I put it out there where I worked for myself on the side or whatever, I did side work, which I did a couple times. We'll say often. I don't want to say too much, because I don't want to sound like I was freelancing and then working another job or whatever. Anyway, the point is, I was able to charge a certain amount of money per hour, and get, I don't want to say get away with it, but get paid that because that's what my time was worth because of the training and the knowledge that I had, and that, if I'm the only guy that's going to come out at 3 o'clock in the morning. So I understand your point. There's a certain amount of training you have to do this stuff. So, okay. But I wasn't sure. Again, I figure while I have you here to pick your brain, ask you, I know you're not going to blow smoke. I know you'll tell me the truth. So might as well ask you whether or not there's a huge markup or not. But I get it. Fair. That's a fair assessment. So, okay, moving on. I want to get onto some health effects.
Well, okay. Oh, before we do move on, I mean, I will say, dentistry. You hear somebody says you a fee, and you go, oh my God, no. But dentists, the reports that I've seen, if we were charging and had kept up with inflation as a profession over the last, say, 40 years. Nobody would be able to afford dentistry. It would be so much more expensive if we had kept up with inflation. And dentistry as a profession really has not kept up with fees the way other fields have kept up their fees with inflation. So couldn't give you specific numbers, but it's from what I've seen in write-ups and whatnot, it's nowhere near what we would be charging if we had kept up with the devaluation of the dollar.
Fair enough.
So,
well, that's why I want to give you. Having you on, I could pick your brain. I have enough time to pick your brain about health effects and all this other stuff. But I figured I'd ask you that because I know you'll give me an honest, even-keeled answer. So there you go, ladies and gentlemen, right from the mouth of a dentist.
So if somebody out there has a tooth that's infected and you're wondering whether or not you should get the tooth out or pay the rent, go without the lights, or pay the electric bill, go without the lights for a month and get the tooth out because an infected tooth could kill you. Infections can spread throughout the body very quickly from an infected tooth. An abscessed tooth will travel through the tissues, spread down through the neck, head towards the heart, or worst case scenario, gets picked up with the bloodstream, goes straight back to the brain, and that's pretty much a death sentence. So,
well, that leads me to the next part of the info that I wanted to pass out to people and things I wanted to go over with you, which this is one of the things we had chatted about off air. Health effects of bad dental hygiene. We can get into the health effects of fluoride and stuff in the last segment because we got a break coming up in about 4 or 5 minutes, but let's going into until we go up to the break. Let's take the last couple of minutes here, and let's focus on like bad dental health. Okay, and I know this is going to sound like a PSA for people, but not many people realize this. I know a lot of veterans that don't even have the best dental health, and you'd think that that's something basic that people would know, but look, it's important to go over this and to hear it from a dentist himself. Now, I asked you off air, Jason, if it was true that poor dental health can lead to heart issues and other health conditions, and you actually said yes, that those reports and studies that have come out saying that are true, that poor dental health can lead to heart problems. How so?
Okay, what happens basically is when somebody has gum disease, and it's not from, you're not going to get this from cavities that you neglect unless you get to the worst case scenario where you've got a massive abscess and it's spreading. What happens in gum disease is it's a chronic low-grade infection. It's your body knows it can't fight the bacteria that are causing the gum disease, so it starts to deteriorate the bone around the teeth to get rid of the teeth. Any chronic infection is a self-destructive type of infection, a slash and burn defense that your body is putting up. So what happens is in the gums, you've got this active infection going on. You've got bacteria. You've got your white blood cells trying to fight it. And what's generated is a protein. It's a cytokine protein, and that triggers other effects in the body. It gets picked up by the bloodstream, and that can lead to the deposition of cholesterol deposits, which are called arterial plaques in the heart, and can cause heart disease. It's also being implicated as a contributor to diabetes, having effects on the pancreas, and it's also being implicated as a contributor to Alzheimer's or stroke because of, again, restriction of blood flow through the brain. And those are the big ones. There's some other smaller ones. I can't recall off the top of my head, but those are the big ones. So yes, gum disease will cause other problems or make them worse.
And if someone says to you, well, I've had poor dental hygiene for 20 years, so what does it matter now? Would you say to them it's never too late to start, and change your habits?
It's never too late. I mean, nothing, there is no substitute for brushing and flossing. You've got to do it to take care of your teeth, to keep them. But if you're at the point where you're looking at losing teeth and whatnot, don't hang on to them. Just get rid of them, get them out of the way, let your body heal itself, and get healthy.
And then go from there. I'm sure you can get dentures or look into whatever. Yeah. But the key thing would be to try to hop on it ASAP. And, most people, a lot of people, even if they have, dirty teeth or plaque teeth, filled teeth or whatever, they could at least, again, it's never too late. Because I've had conversations with people about things, other health issues, and they'll say, well, I'm this far, it's too late now or whatever. So, and I know people, that are like that with their teeth, where it's the same thing. So, it's never, I always tell people it's never too late to make positive change, even if that means that, taking care of your teeth, taking care of your health. And I know this sounds odd for me to be talking about this for a few minutes with Jason over, instead of the fluoride and the mercury and everything else, but this is part of the solutions that I give out. This is part of that same thing. This is in that same vein. I'm trying to give you accurate health information from a medical professional. Now, who better to tell you than a dentist that, yes, it is true. These aren't bogus stories. The studies that have come out connecting a lot of different things, including heart disease and other issues like even diabetes, that was new to me, to poor dental hygiene. You got things getting into your bloodstream via, the plaque and bacteria getting up in there, into your gums. This is no good, ladies and gentlemen. So it's important that we cover this. When we get back, Jason and I are going to get into the health effects of fluoride, not only on your teeth, but on your body. So stay tuned for the final segment. We'll be right back. Ladies and gentlemen, we are back. Final segment of tonight's Friday edition of Down the Rabbit Hole. And I want my guest, I want to afford him a few seconds here to plug his business one more time. So, Dr. Pujo, if you will, feel free to plug your dentistry practice, sir.
Thank you. So, it's located in Drake, Massachusetts. Area code 978-957-1898. And the website is pujodentistry.com. We have a couple of write-ups on the site about amalgam and about fluoride if you want to check those out. They're a little more in-depth than what we're going into tonight. But we'll get to some of the health effects in a couple of minutes. There you go.
And Jason, before I forget, I want to give you a big thank you, sir, for coming on. I know you're a listener to the broadcast and everything else, but you took 2 hours out of your night tonight, to come on the broadcast and talk to people. And I know you took a little bit of time to get ready to come on, because you have all your information stuff about fluoride and everything else that I could pick your brain about, at hand or in your noodle itself. So I really appreciate you giving me your time for 2 hours, dude. It is very greatly appreciated. I genuinely respect you as a medical professional for coming on air and having the courage to do what you do, sir.
Hey, thank you. Just like I said, I'm just doing my job.
Well, see, that's the way it's supposed to be. Dentists are supposed to do their job. All right, so let's get into the health effects of fluoride. I know it's, people have heard this, that, the other thing. Let's go over the horrific health effects. First, let's start off with the effects on the teeth, especially with the younger generations, and then let's get into what you know about what it does to the body in general.
Okay. So fluoride's effects, for strengthening teeth, it does actually strengthen teeth, but in a topical format only. It does not work systemically, and that's been proven through studies. Studies came out back in '99 showed that and conclusively proved that it does not work systemically by drinking it in the tap water or using it as a supplement, or taking it as a supplement for kids that, I suppose if they're on well water, they don't have fluoride. It doesn't do anything to the teeth that way. What it does do, or make them stronger that way, what it does do is it gets incorporated into the structure and in higher concentrations makes the teeth weaker. you start to see discolorations called fluorosis. They're white spots, and then at a higher concentration in the tooth structure, you get a brown spot, and then in much higher concentrations, you can get deformations of the tooth, which I have never seen in practice, but it can happen.
And so dental fluorosis is, to be specific, when people hear that, because I know sometimes a name will get used as a label, and then it'll get misused, and I know you know what I'm talking about. So fluorosis is the discoloration of the teeth, and then is there pitting involved, like holes actually being rotted through the teeth and into the through the enamel into the tooth structure itself?
Pretty much, it's that it never forms in the first place. Like, it deranges the cells as they're growing the tooth.
Oh, from within. Okay, yeah. So it deforms it from within, and then it doesn't grow the proper enamel or enamel at all.
Right. Exactly. So it doesn't secrete the enamel the way it's supposed to be forming.
Okay, so that's what dental fluorosis is. Okay, I wanted to get a clear, concise explanation of what it was out there, because I wasn't sure myself to 100% accuracy, and I know if I wasn't, then I know a lot of the listeners probably aren't, so I just wanted to make sure. So, okay, go on. I didn't mean to cut you off.
That's okay. So they, according to the studies, the dental fluorosis is also an indicator of skeletal fluorosis, or how much fluoride is incorporated into the bone structure, and that's what can lead to bone issues. Can lead to bone cancer. It can also lead to I'm just looking up something here.
I know
the osteosclerosis, which is a denser bone, but bone's one of those materials where it has to be within a certain density to function properly, and if it's too thick, it becomes brittle. If it's not thick and if it's not dense enough calcium-wise, then it becomes weak. So you've got a certain range where it's designed to be, or a certain design parameter that bone fits in, and anything beyond those tolerances, it doesn't work as well. So
let me ask you this: do you think that a lot of older people having issues, like when they fall down and they break hips, and how people just go, well, you're older, your bones are less dense, they're more brittle, it's just part of old age. Do you think a lot of that has to do with the exposure to fluoride over the course of time?
It could be. It's possible, but you'd have to do bone density tests, and I don't know, what the findings are on those, because those are done if somebody is suspected of having osteoporosis, but some of them could be osteosclerosis, and it could be the result of fluoride. But again, I'm not, I don't have any figures in front of me.
I wonder how they'd be able to even tell, though. You could do a bone density test, but would they be able to tell what really caused the bone to become brittle and less dense? If they actually went and did the research, I'm sure they maybe could figure it out. But I'm just trying to figure out what would be like a telltale marker. I wonder if there would be some traces of fluoride in the bone tissue itself, or something that they could find that would, they could definitively say, look, you see, there's your proof. That way you could end this retarded argument that there's no scientific proof that fluoride causes damage when there's a ton of it. But you know what I mean? It's just, I think that might help be the nail in the coffin for that invalid argument on their behalf.
Right. Is actually doing the analysis of the bone and see what's going on.
Yeah, like take a biopsy or whatever you want to call it of it, and send it in for analysis or whatever. Mm-hmm. And then I'm sure if they found like a high concentration of fluoride, they could, judge from that, or make an educated guess from that probably had something to do with why the bone was less dense, and then blah, 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 blah. But then again, would that even be ever released to the public? I don't know. But I digress. Go on.
Okay. The other big effect that it has, which, is interfering with melatonin production in the pineal gland. And so that interferes with your normal wake and sleep cycle, and that does alter when puberty begins. And
that's also your third eye. Mm-hmm. And melatonin. So if people remember, I played about a week and a half, 2 weeks ago, I played a broadcast. On one of the broadcasts I did, I played a documentary about EM fields and how they affect human health. And one of the side effects of these EM fields and everything being around us is it affects our pineal glands and causes it to. It has different effects on it. One of the things is it won't produce melatonin, and I don't want to get too sidetracked into it. But again, you have melatonin being targeted and the pineal gland being targeted. Now, why would they want melatonin not to be produced? Well, not only does it make you tired and sleepy, but it repairs your body. That's what your sleep is for. The melatonin repairs the damage to your cells at night. For an easy nutshell answer. And why would you want, if the powers that shouldn't be want to take you out, and they want you to have ill health and things, right? And they want you to be more susceptible to disease, or they want you to be they want you to be more susceptible to whatever. I mean, but the other thing, fluoride, the other effect fluoride has, by the way, is the fact that it takes your urge to fight out of you, and they know this. They know this going back to World War II. That's why Hitler and Stalin used it in their prison camps. I mean, do you really think Hitler and Stalin were concerned about dental health? Come on,
no.
You know what I mean?
At that point, yeah.
Right? And you know who told me that? My mother. Because my like I told you, my grandmother was in a camp, and during World War II, and she actually, I remember when I was a kid, she fought fluoride, the water fluoridation in my town, as much as she could. Not protesting or whatever, but going to the right people and talking to them and everything. And she told people to vote. She got out there and told people that she knew at least not to to vote against it. And I didn't understand why fluoride was bad for, on so many levels. But she just explained it to me basically in a nutshell, like I just said. She said, look, remember your grandmother was in a camp? I said, yeah. She goes, well, Hitler, and she knew about Joseph Stalin. She said, Hitler and Stalin used it in prison camps. I said, okay. She says, well, do you really think that either one of those two dictators and evil people were concerned about the prisoners' dental health? And I looked at her and I was like, well, I guess you have a point. Mm-hmm. So when you look at it in that simple, that simple light, that alone. But yes, it has many health effects. And one of the things it does, I know, is it does make you not want to fight back. But there are so many other things. Now, the pineal gland, again, I find it interesting how that's under attack on so many levels. And ladies and gentlemen, the only reason why I sidetrack for a second and say that is, and I remind you of that, is because it's important that we look into the functions of the pineal gland and all these other things and understand how our bodies work, because this is part of us getting ourselves back on the natural track and the natural course of things and righting the train. The train has been derailed, and we are all trying to get the train back on the tracks. And part of that is learning how your body actually works, because that's how they keep us in control, is by keeping us out of tune with our own bodies and each other and everything else. That's a whole nother broadcast in and of itself. So, Jason, as a doctor, knowing the health effects, knowing that fluoride, can cause bone cancer, mm-hmm. Would you say that it needs to be removed ASAP from every water supply across the country? No exception, no reason it should be in the supply period. It just knowing the cancer the cancer causing possibilities of this, not to mention anything else, the dental fluorosis, the bone weakening, anything else, just the cancer causing aspect of it alone. Don't you think that it should be removed from every water supply, hands down?
Of course. It's crazy that it's still being used, especially since this stuff is known. But there's a lot of money behind it too. So, and
a lot of people, by the way, are when you say fluoride, they go, well, natural fluoride, and that's what's argued. No. The crap that's in our water supply is not natural fluoride. It comes from places like the Alcoa aluminum plants. Okay, wherever Alcoa aluminum, wherever their processing plants are, it's a byproduct. It's called fluorosilicic acid, and it's a byproduct of the aluminum process. That's not healthy.
Yep, and it also comes from the phosphate fertilizer mining operations too. Yep,
that's one of the other spots it comes from, which phosphates, no good by themselves, but then when you find out that this stuff is like a byproduct out of it, and it's not natural fluoride that one would, let me rephrase that. It's not natural fluoride that doctors and dentists and that people are told that is okay to have inside your body. This is not the same stuff. This stuff is highly, highly toxic. So not only is this garbage, think about the scam that is, Jason. Not only is this garbage, right? And they can't get rid of it. By the way, the EPA says they can't throw this into landfills. because it's like an environmental crime to put this same crap into a landfill. So it's not okay to put it to a landfill, but it's perfectly okay to dump it into the drinking water supply or put it into a liquid form and spray it onto the food as a quote-unquote pesticide. Let me ask you this. How is using the same substance as a pesticide, how is that okay to use as a health preventative or you know, whatever, what do you call it, preventative medicine? How does that, does anybody see the like, just the total asinine thinking going on there? You're talking out of both sides of your mouth. You know what I mean, Jason? You're using this stuff as an insecticide to kill things, okay, to keep insects off your food, off your plants, and then you're telling humans, but it's okay to drink and put in your food. And I mean, they're spraying it on our food, by the way. So even if you take it out of your toothpaste and your water supply, they're still spraying it on. If you have conventional foods, if it's not all organic and you don't know, you can't, you know, if you can't prove for a fact that it is organic or whatever, if it's conventionally grown, they're using fluoride as a pesticide. It's one of the things that they spray on the fruits and stuff. So you have to wash your fruits and vegetables if they're if they're conventional. Then you also have GMO. That's a side issue. But the point is, fluoride's all around us. It's like the Matrix, you know, like Morpheus. Its way. It's all around you. Well, so is fluoride. It really is literally all around you. Will I tell you to get one specific water filter or something over another one? No, I don't have any specific sponsors or anything, and I don't know of any one that works better than the other. I know Berkey's are okay. I also know the one that actually, there's a filter place that sponsors they're one of the sponsors of the network. I forget the name of the company. It's on the front page of the of OrionTalkRadio.com. But I know somebody that has one of their filters. I've physically seen that thing, and it works. And the water that comes out of that thing is amazing. So I can't remember the name of it, but the one that Orion, one of the sponsors on Orion, I know someone that actually has that filter. So that one, Berkey, stuff like that, anything that really does take the fluoride out, you know, whatever. I'm not going to, you know, try to publish any one filter over another. As long as you have something that can filter out all the crap that's in the water and fluoride as well. And, you know, honestly, I really don't think, unless you have a reverse osmosis filter or system or whatever you want to call it, I don't think you're going to get really everything out. And then with reverse osmosis, you have to, you know, I think some systems will do it. You can just add I think it should add a little bit of salt and minerals or whatever back into it. But reverse osmosis is the only thing I could think of. If you can afford a system like that on a house, then go for that. You know, because that's something that'll definitely get everything. That'll not only get the fluoride out, but that'll take all the pharmaceuticals that are in there out. Remember, a lot of the water that we drink is tainted because you have people that when they go to the bathroom, and I know people don't like to think about this, but water is recycled. Just remember that. So just remember, tap water is recycled. Don't think so? Okay. Go check it out in some areas and tell me again. Anyway, in that water supply, even if it comes from a natural aquifer, the natural aquifers are being tainted if it's not being dumped in on purpose. They're being tainted with a lot of these what do you call them? The pharmaceutical drugs, the head drugs. Forget what they're the antipsychotics and that type of drugs like Effexor and Prozac and Zoloft and all those
antidepressants.
Yeah, them. Thank you. I couldn't remember the term. But my brain is just not functioning tonight. Thank you, Jason. And the water supply itself, for many different reasons, many different areas are affected by that stuff. So I would say, for me, solution-wise, I would offer go ahead and get some sort of water filter. Try to take out the fluoride as much as you can out of your toothpastes. Get, like I said, there's natural toothpaste. You even heard Jason. He's a dentist. He's telling you can make your own baking soda-based toothpaste, and that'll do the job. You just need something to be a little, naturally soft and gritty enough to help maybe move some of the plaque, but you don't need super hardcore anything. And, that'll do the job. And saltwater rinses. If you want to do it El Natural, do it El Natural. I say as much as you can get away from chemicals. And again, it's not just in your toothpaste. It's not just your fluoride. It's also sodium lauryl sulfate. People, Google it, look it up, look at the effects it has on your body, and then look at all the products that it's in, because it's not only in toothpaste, it's in shampoo, it's in a lot of other stuff. So try to remove all of that. Look, I know it's a pain in the butt. I really know it's a pain in the butt. Trust me, I had to change my whole life and alter everything because of this stuff. But you don't have to do it all once. Don't rush. Oh, my God. Start off with your toothpaste and your shampoo and then work from there. I mean, those are the two easiest ways to control the intake. Get a water filter when you can afford it. If you can get some, I get bottled water from a place that does reverse osmosis to their water. So it's like if you drank this as opposed to even bottled water, you would definitely see the difference. Although most bottled water is just tap water anyway, run through like a Brita water filter, if they even run it through a water filter. Jason, we got a few minutes here till the end of the broadcast. Last final thoughts, solutions, anything you want to throw out to the listeners?
Well, the water filters is definitely a big key strategy there. And yeah, I myself have a Berkey, but from what I can see is that any of the major brands are good. So I put them on our website. There's Berkey, there's Pure Effect, the Pro Pures, and Dalton. Dalton invented the gravity filter back in the 1800s, so they do make fluoride filters for them. And there's probably others out there. I think Cotadin is another company that might make them, but I think there's a plastic base. Not that that's a bad thing necessarily.
Oh, and a shower filter I would add too.
Yep.
I have a KDF shower filter on my my shower, and it's funny. My wife years ago when I first got the shower filters and stuff, she didn't believe. She would whatever. And I said to her, okay. So she, and she's one of these 2 showers a day people. So she. Well, she does. She's a yoga instructor, so she'll get up, in the morning, take a shower, and then when she comes home from work, she's drenched in sweat, so she has to take a second shower. And she took a shower in the morning, and later on in the afternoon, I had switched the filter out, and she had taken a shower later on in the afternoon, evening, whatever it was, because this is a couple years ago now. Anyway, she took a second shower that night, and when she took the second shower, she was like, "Oh my God." Because I wanted to get her. I was like, you're the first one using the water filter. Tell me the difference. And she told me it was literally the difference between being stabbed and not being stabbed in the shower. And I didn't understand what she meant until I got in the shower. And all the crap that's in the water, when you get in the shower, if you have just a regular tap, like water, tap water, and you have no filter, when you're in there and you feel that stabbing sensation when the water's hitting your back, that's all this crap, the microparticles of fluoride and also other heavy metals, rust, and whatever other garbage is in there. That's actually that crap penetrating your skin. That's what that feeling is. And you literally don't realize this until you get a filter and you put it on your shower, man, and you get in the shower and you're like, holy crap. It really, it feels totally different when you remove everything, all the garbage. Same thing with your water when you drink it, right? Mm-hmm. When you remove all the garbage, it tastes totally different. It's amazing. So I agree. Filters on your shower, your water. Anything else, Jason? We got about a minute. Go ahead.
Here's a quick little recipe for another rinse. Baking soda-based rinse. 8 ounces of water, 1 tablespoon of baking soda, 20 drops of peppermint oil, essential oil, and optional would be 5 tablespoons of xylitol if you want to give it to your kids for them to use. Mix it together, rinse for 45 seconds, and spit. It will get your pH in the right alkaline, neutral to alkaline range. It'll shut down the bacteria that cause cavities, help prevent cavities, help rebuild your teeth because it's the right pH for the calcium and the other minerals that are in your saliva to enter the tooth structure. And you can mix it up yourself, and it's dirt cheap.
Wow. See, that's how I like to end a broadcast, ladies and gentlemen. On a positive note. Solutions. Jason, I can't thank you enough, sir, for coming on the broadcast. Again.
Well, thank you. It's been fun.
It definitely has been fun, sir, and I'm going to have you back on. Ladies and gentlemen, I thank you all for tuning in again, if I can get the words out, as always. And I'll see you all again Sunday. I love you all. Make sure you educate yourselves. Pay attention to what's going on and take care of your bodies.